Namaskaram. Today we are going to discuss one of the very important neurological clinical issues that our society is facing, cerebrovascular accident, or colloquially called stroke. In that area, what does Ayurveda has to offer in the present scenario? It's an important thing that we need to discuss. If we go through the ancient text like Charaka Samhita, Susruta Samhita, Ashtanga Sangraham, Ashtanga Hridayam, etc., we could very proudly say that the most ancient clinical documentation of neurological clinical cases and their respective causes and diseases, we could see these in these texts under the big spectrum of Vata Vyadhi, wherein Pakshagadam comes under the bigger spectrum of Vata Vyadhi. So, Pakshagadam or hemiplegia or stroke, as we very commonly see, broadly comes under two categories, whether it is ischemic stroke or hemorrhagic stroke. We all know that issues like non-communicable diseases with the range from diabetes to hypertension, smoking, alcoholism, stress, etc. are predisposing factor to these stroke. Uncontrolled diabetes, uncontrolled hypertension, dyslipidemia, etc., make a person prone to a possibility of a stroke, wherein generally a part of the brain is actually having a depreciation in the blood supply, which makes the brain tissue dead, and hence the area that is supplied by that particular part of the brain gets completely off its normal function. The same entity has been explained in Ayurveda under the name of Pakshagadam, wherein because of the Visheshna of Vata in entities called as Sirasnayu, half of the body starts to function abnormally or with no normal functions generally. So Ardhitam, Pakshagadam are two spectrum of clinical manifestations that comes under the cerebrovascular accident scheme as explained in Ayurveda. And when we see what exactly is the possibility for stroke cases in Ayurveda, there are two aspects. One is a curative aspect and the second one is preventive aspect. Let us first talk about the preventive aspect, which actually includes to prevention of stroke who are prone to this particular area, who are already afflicted with the NCDs, and there is a possibility with premonitory symptoms like an affliction of TIA, etc. If we undergo very specific Panchakarma therapy, definitely to a great extent we can prevent the occurrence of stroke. Now, once we think of the curative aspect, a patient who is already afflicted with stroke, either a hemorrhagic stroke and ischemic stroke. We all know hemorrhagic stroke is definitely a quite more dangerous situation. But if the patient comes out of the hemorrhagic stroke in a comfortable position, the response of hemorrhagic stroke to Ayurvedic treatment, we have seen it is much, much faster when compared to the ischemic stroke basically. So definitely, as we say, window period for having the initial treatment in the modern medical system, in the similar fashion, even with Ayurvedic background, when the patient comes to us at the earliest stage, at least within 1 month to 3 months of the onset of the disease, once the patient is hemodynamically stable, definitely Ayurvedic interventions would support the back to normalcy. How easily one person can be back to his normal activity again depends upon the strength of the individual, the comorbidities that is there already in the background of the patient, like how long he was suffering from diabetes or hypertension, etc. And how strong he is mentally and emotionally is also an important aspect that we always clinically observe. And it is very imperative that we say that the emotional status of the patient has got a great role in the response that we see after the treatment in the patient. Now, when we say what treatments we do for these cases, again, it is very important that we analyze the individual patient with his own parameters, because Ayurveda has got a very personalized approach, what we call it as Nidanam, the cause of the issue, the Rupam, how the patient has presented clinically, everything will be different from individual to individual, and the treatment that we offer will also be differing according to the affliction of the patient. So major in the initial stage, if the speech is affected, if the patient is having dysarthria, aphasia, etc., the treatments like nasyam, kshirodhumam, etc., are given. And then once the patient has the speech normal, but the afflicted side, either right or lower limb, becoming weak with power maybe 3 or 4 or even 2, to a great extent, walking, lower limb response happens in the earlier stage, which upper limb usually responds in a later stage. But definitely in the initial phases, the upper limb movements at the level of shoulders, we are able to bring it up. Major treatments that are involved in this Ayurvedic management includes Vasti, Nasyam, procedure like Shirovasti, and there are some external therapies like Potalaspedam, like Ilakkiri in Malayalam, Jambirapindasvedam, etc., which will be applied selectively for the patients depending upon their analysis of dosha and dhatu in Ayurvedic terms. So I think as a responsible institution, it is very important that we give the best care to the patient. A combined response with systems including physiotherapy, functional medicine, etc., and Ayurveda coming together can definitely offer the best solutions to people who are suffering from severe. Thank you.